Chair of the Mosaic Life Care Board of Trustees. On behalf of our board, our doctors, our nurses, and thousands of amazing caregivers, I am honored to welcome you to our press conference to announce the next CEO for Mosaic. This is a very exciting time for all of us. First, I would like to thank the many caregivers that participated in the CEO search throughout our system. They helped the board make the decision of who would lead us through this next chapter for Mosaic. There were more than 40 incredible, impressive applicants for the CEO position from an extensive national search. This speaks to the strength of Mosaic and the high-quality care we provide in our region. But in the end, one candidate stood out amongst all the others. He won us over by his top-notch record of leadership with more than 25 years of Chief Executive Officer experience throughout the United States, strong character and values, and his servant leadership style. His ability to strengthen organizations and lead with courage and commitment. His record of growth overseeing multiple hospitals with complex, different needs with a quiet, determined strength. And his clear dedication to our communities, which aligns perfectly with Mosaic's vision statement, the needs of the patient come first. Please join me in welcoming the next Chief Executive Officer for Mosaic Life Care, who has chosen to remove the word interim from his title and make it permanent, our next CEO, Mike Poore.
Thank you, Serena. I am humbled and honored to stand before you, the caregivers, and our community, and be your next CEO for Mosaic. I wouldn't be here if it wasn't for my better half, so I want to introduce my wife, Penny. And I also have my favorite child here, Mackenzie. So many people have asked me, why did you decide to remove interim? Because I've been doing this for a couple of years, and I've been at hospitals throughout the United States, and I've done 4 other interim stints. And the answer is, if you could see what I see, it is a no-brainer. This is a fantastic organization. It is a fantastic community. And I have been blown away by the hospitality in this community and how people are so genuine and engaging throughout the community. But the other things that I wanted to bring up are that this hospital has done amazing things for our community, for our patients. And we have gone outside the 4 walls of the hospital to take care of our patients. So we're excited about that, and we have a lot to do in the future. As I said, we've been welcomed to the community. I've talked to several community members about the gem that this hospital is. Being one of the top caregivers in the community, being the top employers in the community, 150 hospitals throughout the United States, we were named in that top 150 for the best places to work by Becker's Healthcare. We are a 4-star hospital from CMS, Centers for Medicare and Medicaid Services. We're on the McKnight's Excellence in Technology Awards for Voice to Text for technology. We have Health Grades Pulmonary Care of Excellence. We've also received the highest level of recognition from the American Heart and American Stroke Association. We're ranked number 13 among 2,500 and more employees in Missouri in Forbes magazine list for best employers in the state. So it's this and the care that's given every day by all of our caregivers, more than 4,000 caregivers in our community. And we are so excited about the future of what we offer in healthcare and how we serve all of Northwest Missouri. For our communities, I see, the rural health care programs are important, and we're a big part of that in maintaining rural health care, both in Maryville, Albany, and here in St. Joe. So we're excited about growing these specialties, about how our patients can receive care close at home. You don't have to travel to get the care that you need in this community. So again, and I've said this a lot in our community, we have a gem here. And the gem is our people, our commitment, our passion for healthcare. And I'm excited to be a part of that in going forward here in St. Joseph. So if nothing else, I just want you to know that you have my full commitment and my passion for healthcare to make sure that this is the best place to take care of your family, because it will also take care of my family. And you have my dedication to know that we will always do our best. So with that being said, I'll take any questions that you may have.
I think when we talked with you last time, you said you weren't going to take the permanent job. What changed?
Well, what changed my mind is the people in here right now and the people in the community. I really did not expect to be received so well in a community, and how people are just very genuine. Now, the hospital, and when I talk about hospital, I don't mean bricks and mortar. I mean the people in the hospital. The people in this hospital are amazing. We are so fortunate to have their talents in this community, and I wanted to be a part of that. I was blown away from that. But my wife and I have been well accepted in the community, and as Penny has said, what's not to like? You've got a great standard of living here. You've got great accepting folks, and we want to be a part of that.
Well, I am interested, though, how'd your thought process go? Because you came into this, I don't think you were thinking in terms of being permanent CEO. What changed? When did it change, and when did you start thinking?
Yeah, so that's a good question. So there was a couple of factors that changed my thinking, because you're right. When I came here as an interim, and I've done those, everywhere from Lewiston, Idaho to Virginia, and there was a couple of things. So one, we had executive retreat with the leaders of the organization, and I can tell you it was amazing to watch these leaders. And I've told my colleagues I'd take this team into battle with anybody. They are a very intelligent, very experienced, very engaged, and very passionate group. And so, that's a lot about your work-life balance, is that you have people that you want to work alongside of and do great things. But then beyond that, it was the community, because I'm very focused on balance, and I want to be a big part of the community as well as a big part of the hospital.
Well, can you compare and contrast your experiences working for a for-profit hospital corporation versus what Mosaic is?
Yeah, so that's also a very good question. I've worked almost a decade in for-profit and companies that are publicly listed, and those companies do very good work. But in for-profit and especially publicly listed companies, it's the quarter. What do you do this quarter, and can you meet the next quarter? And many times that can make it lopsided while managing a hospital, and you lose focus on what you're really there for, and that's caring for the patient. And I don't mean to criticize for-profit. I've worked in it, and there's a lot of great people doing great work. But in a not-for-profit, and especially an organization like this that is a cell community provider, we can focus much more on the long term and on making our communities healthier and being that life care company instead of, or life care organization instead of a healthcare organization. We have a lot of work to do, and we're going to be here for the community if you need trauma or cardiac care or oncology care. But we just had our opening of our oncology center. We just put $12 million into that. That is a world-class center, and our work with the Mayo Clinic and being a Mayo affiliate, we are blessed to have that as an affiliation so that we have access to the latest and greatest technology and minds in healthcare that work alongside our fantastic providers.
I guess conversely or otherwise, how much more are you going to be watching reimbursements now? Just that is such a concern with what you're getting federally and in repayments and not relying as much on insurance.
Well, I tell you, every hospital has to be good stewards with the dollars that we have. I've always had this philosophy: I don't want a penny more than I deserve, nor a penny less than we deserve for the care that we give. So we are constantly going to be taking a look at being good stewards with the revenue that we have. But we also know that we have to help bend the cost curve in the community, that healthcare costs can't rise exponentially forever. This last 2 years with COVID has been a huge impact on every healthcare, every hospital in the country and every healthcare setting in the country. And that, run amok inflation on especially labor costs, but even our supply costs can't continue, and we've got to figure out a better way to do it smarter.
Was this always something, you talked about having interim roles in the past, was this always something that personally you had in your back of your mind, or something you thought that you would eventually want to do, taking a permanent CEO position somewhere? Did that come as a surprise as well?
I'd always thought about it, being the right situation and the right opportunity. And this one was that right opportunity. It checked all the boxes. A great community to live in, a not-for-profit organization that had a strong history that I could be accretive to and help build the organization. So it's something that excites me. As I've told my colleagues, it's actually reignited my passion for healthcare, seeing what this team does and how I can be a part of that and work alongside the team members here. The other thing that I wanted to point out too is, in part of our charter, we talk about being a physician-led organization. And we are still a physician-led organization. And I've done this my whole career. I understand that our physicians, our providers, are the ones that set the clinical direction of the organization. I don't have a clinical background. I've just been in hospitals for 35 years. So I look to my physicians, and I always have in my career, to set, this is where we need to go for cardiology, for oncology, for orthopedics. And I provide the team and the professional management to ensure those visions happen.
There's been several, I guess, changes administratively here at Mosaic. I guess now that you have taken off the interim title, how do you address that moving forward? Just you talked about wanting to go to battle with your team, but how can you continue to look at potential hirings and staffing for the administrative side and through the hospital?
Well, again, a good question. We have some positions that we need to fill. We are on a journey right now with Epic for our hospital information system. The Epic install is an $85 million commitment that our board has made to bring us to the latest, greatest technology for information systems. That is a year-long process, and we'll be going live March 4th of next year. So as you can imagine, my number one priority is a chief information officer. And I actually convinced the board to begin that search before we named the CEO, because I knew that it was that important. We've interviewed 5 candidates. We've narrowed those to 3. We start our second review of those candidates next week. So that's the first one that I feel like we need to fill, and we will very soon. We will shortly be searching for a new chief financial officer. That is the next most important position we need to fill as an organization. And then the others will come, as we need them. But those 2 are most important now.
As you assess Mosaic, and you've been here for a while, what do you see as the strengths and weaknesses of the system?
Well, so the strengths are many, and that's the interesting part of this. So every hospital in the nation have been stressed through this COVID situation for the last 2 years. We've been stressed on our staffing, we've been stressed on our supplies, all of those things. And every hospital in the United States has dealt with the same thing. The difference here at Mosaic is our people. Our people have been dedicated through this whole ordeal. And it's amazing coming out the other side. When I'm rounding with the staff and talking, I had a discussion the other day, and the discussion is, we feel like this weight has been lifted with COVID, and it's time to be happy. It's time to celebrate. And one of the nurses the other day told me, yeah, it is time for us to be happy. It is time for us to celebrate. So we have that strength. Our people are always our strength in here. The other thing is we're in a great financial position compared to many hospitals in the country. We've had stress on our financials. We will have a negative year this year. Our year end ends at the end of June. But not as bad as others. And fortunately, we have the coffers that we can cover that while we reorganize and decide how we move forward as an organization. Weaknesses, it's interesting, and I'm still on a learning tour right now. I've been here less than 90 days. But the interesting thing, and this is going to sound self-serving to an extent, but the interesting thing is that the perception in the community that, just because the cares in St. Joseph or Maryville or Albany is that you can't be that great, that you have to go to Kansas City or some other big city to get world-class health care. And we've got to overcome that because we are giving that world-class health care here today, every day, treating our patients. And we're fortunate to have, the caregivers and the physicians, providers that we have in this community. We are very fortunate.
Any other questions?
You mentioned, when we talked to you before, so you mentioned your management style. Could you reiterate?
Yeah, so
Does it change when you're interim?
Yeah, I've become an ogre. No, no, actually, it's interesting. It's like I told the leadership when I first got here. What you see is what you get. This is me all the time. I've done this long enough. I've had good mentors and good experience that has helped me, be the manager that I am today. I tell people who report directly to me, I do 3 things for you. I knock down the barriers that get in your way from doing your job. I give you the tools to do your job. And then I get out of your way and let you do your job. And what I'm talking about there is, especially with highly motivated, very passionate caregivers, they are self-determined. And if I can give them the tools they need to do the job and break down the barriers, I have always been pleased with the outcomes that teams can get to. And so I am excited about working shoulder to shoulder with this team and making things happen.
Thank you all.
Thank you.